Well, that's not the right answer. That's not the right answer. And there will be, the old 80-20 rule. I think if we provide the resources, we provide the environment, we provide the services in the environment that they can access, a lot of times people can't access the right information. And they don't comply, not much we can do about it, is there? Now, I don't know what percentage of the population that's going to be, but one of my suggestions when I meet with the senators and legislators in Washington is you need to put some type of incentive or disincentive. And I believe that we have to have, within the context of any public program, something has to do with patient accountability. That you essentially are developing a care plan. If you don't follow that care plan, you're responsible for your care. It's that simple. You don't take care of your car and it breaks down, you can't call your insurance company and say, my car broke. I didn't change the oil. Give me a new one. We've got to take personal accountability. There will be a population that won't. And for those individuals, I don't know if it's 5%, 10% of the population, I don't know what it is, we're going to have to deal with it. We're going to have to penalize it for not providing the, following protocols, just like everyone else in society has to. But we can't worry about those folks. We have to worry about, the other 300 million individuals in this country that probably will comply. There's a question back there? Yes, ma'am.
I want to go back to the topic on the universal healthcare plan and things like that. I haven't read any of the healthcare reforms, but I'm going to rectify that pretty soon, I'm sure. However, I do have a concern about it, and maybe you might know. Coming from the UK myself, I know that you can get in to see physicians at some point, but it takes a long time. And now that I'm over here, if I want to say go and see a specialty of some sort, I can get in almost within a week. But you could be waiting months back in the UK to see someone. That is the difference between life and death for some patients, especially if they have tumours of the lungs or anything like that. Do you think that that's going to have some sort of effect over here? Because, I mean, if we're all involved in the healthcare, obviously, patients that we're going to see, we're not going to be able to get them into specialties quick enough to save them. So, what do you think about it?
Everyone hear this kind of a statement and a question, kind of combination. And the young lady is from the UK, and she's experienced less than favorable outcomes of the health system, trying to access the health system. The government says that you can be put on a waiting list that is up to 18 weeks if you don't have an emergency care. I'll repeat that. Unless you have an emergency, you can be put on a waiting list that can go up to 18 weeks. Now do the math on that. How many months is that? Any math majors here? Okay. That's 4.5 months. That is the lowest time. There are folks that have waited 2 to 3 years to take care of a condition that only worsens. Let me throw some stats at you because you'll be astounded. It's not a personal question, but how many young women have had a pap smear in this room? Okay, and when you probably had your first one, you're a teenager or maybe early in 20s. You cannot have a pap smear in the UK unless you're 25 years of age. And up until recently, if you went out and paid for it, you were thrown out of the program. You have to be symptomatic. You have to show symptoms of cervical cancer or you're out of the system.
That 25 years you can't have a pap smear. What do you mean you can't have a pap smear before you?
In other words, right now in the UK, and I'm sharing this with you because I was just here last week talking with the folks in the system. They're trying to save money.
Right.
And they have
Is this like a new thing? Is this like just newly developed? Because
no.
You can go in and see your general practitioner and have a pap smear when you're, as soon as you're sexually active, actually.
If you're symptomatic. I'm telling you as recent as last week, I'll tell you exactly what happened. They had to change, because there's a evidence-based medicine organization called NICE. Beautiful acronym. National Institute for Clinical Evaluation and Excellence. And they go through a formula that's called quality of life years. And they did an analysis that recently showed that the incidence of cervical cancer in women under the age of 25 was very, very small. Very small. So they said, this is costing us X dollars, so we're not going to cover this. That's there today, unless you're symptomatic. Now, that's all fun and games, and nice to save money, but what happens to that young lady that slips through? That's asymptomatic and develops cervical cancer. And until recently, you were not allowed to call what's topping up. Topping up is we can go out and you can buy it yourself. You say, you know what, I'm going to get that test done. A few years ago, you were thrown out of the program if you topped up. So look, there are some system issues that, again, we're not the best system, the UK is not the best system, but what we need to be careful of is that we just don't adopt something because it's universal in nature. There's other ways of solving this problem. There's more than one way to skin the cat. And I think that we have to be careful how and where we ration care, that we're understanding of where healthcare dollars are spent. I'm going to throw another statistic to you, which to me, I'm still amazed by it. First of all, does anyone know how much we spend every year on healthcare in terms of dollars? Take a guess. Anyone take a guess? Do you think it's more than the billion?
Yes.
Do you think it's more than a trillion? How do you think it's more than a trillion? I think it's more than 2 trillion. We spend $2.3 trillion a year in healthcare. I don't know if it's too much or too little. I really don't. But I know it's a lot of money. Of that $2.3 trillion, 1% of the population, this will astound you, 1% of the population is responsible for $700 billion. Digest that for a moment. 1% of the population, how many people is that, 3 million? Are responsible for spending 1/3 of all our healthcare dollars. Wow. Now, remember I talked about root cause analysis and problem solution? Now, if you were sitting in Washington in one of those nice offices they have there, wouldn't you start with a problem? The problem is not one of access, the problem is allocation. What's going on with those 1% of the population that they're spending $700 billion a year? What are we doing? It's called disease management, or inability to manage disease is what it is. That's the answer. So, we've got to be careful as we begin to skin this cat. Do we understand what we're doing here? We've got to take into consideration where the problem lies. We have to take into consideration the fact that, accountability is such a big issue. Our lifestyle is a big issue. How we manage diseases is atrocious in this country. The average Medicare patient who has multiple diseases, on average, sees 14 different physicians a year. 14 different physicians. And guess what? Each time they go, they repeat the same test. They repeat the same test. They repeat the same test. So look, our system is not working as well, but there are ways to solve this. And I'm convinced we're going to ultimately solve it. I really do. Because once we know what the problem is, finding a solution is not so difficult once you know the problem. Yes, sir?
How much would tort reform have in this whole discussion?
Now you're touching something dear to my heart. The question is tort reform. Does anyone know what tort reform is? Essentially, in a few words, what it is changing the malpractice environment. I have a company that I spend about $120 million a year in defending and settling lawsuits. That's $120 million that I could pass